The SMART Coalition services a population of over 530,000 located on the western edge of the Rocky Mountains in Utah County. SMART began in 2007 when the state of Utah was given the Strategic Prevention Framework Grant. A 5-step process was then implemented, the first step requiring an assessment on the community. Focus groups, surveys, and other means of collecting and analyzing data were then carried out. It was now time to build capacity. Kai, our project coordinator, set out recruiting help by searching for interested individuals. With much support, the SMART Coalition was formed. Taking a look at the community assessment, the coalition was led to target the two most important issues, prescription drugs and alcohol. They then questioned which factors were contributing to the abuse of these substances. With regard to prescriptions, the coalition noted 4 major issues. 1. Providers overprescribing. 2. Low perception of risk. 3. The large availability of pills. And 4. Community norms such as sharing. With alcohol, the coalition focused on alcohol-related motor vehicle crashes. They noticed a low detection rate of DUIs, an abundance of alcohol advertising, the social availability of alcohol, and individual factors such as loss of judgment when becoming intoxicated. It was then time to take action. Regarding availability, the coalition to date has carried out and planned for close to 30 different take-back events, and 68,220 prescription pain pills have been removed from Utah County medicine cabinets. To address providers that overprescribe, Representative Brad Daw assisted the coalition by passing 3 pieces of legislation. Those pieces of legislation require providers to 1. Register to use the Department of Professional Licensing's Controlled Substance Database, 2. Obtain education on proper pain pill prescribing, and 3. Be notified of patient abuse if the patient overdoses or has a prescription-related DUI. The results of the passing of this legislation are that 94% of providers are now registered to use the database compared to 28% before the law, and there has been a 70% increase in database searches since the new law came into effect. Furthermore, the coalition hired Health Insight to assist with presentations for physicians. 163 doctors have already been trained, and there are plans to continue holding more of these trainings. Of the physicians attending the presentation, 80% say they prescribe fewer pills since the presentation, and 90% say they spend more time educating patients about pain pills. 3 pharmacy education nights also took place, in which educational materials were distributed to 15 participating pharmacies regarding prescription drop-off locations. To address a low perception of risk and community norms, the coalition contributed funding to a statewide media campaign called Use Only as Directed. For alcohol-related motor vehicle crashes, the coalition focused on a low detection rate. They piloted 2 programs. One was Spillman Technologies, which was designed to assist police officers by decreasing the time spent on paperwork when writing up a DUI, as this was shown to be a deterrent. Secondly, the coalition provided oral swabs to help officers identify the substance causing intoxication. Other achievements of the coalition are being awarded the Drug-Free Communities Grant, which will continue to sustain the coalition into the future. The coalition was also awarded the Friends of Public Health by Utah County Health Department. Another success is the creation of the Key Leaderboard, in which elected officials take part in the coalition's efforts. SMART's future goals include raising the Utah State beer tax and continuing to educate pain pill providers in Utah County.